we see in other countries. Need and deserve a better way, and that's why we've invited these distinguished panelists to talk about the different ways they have sought to fix what's broken in our healthcare system. They didn't rely on government bureaucrat or federal mandate. They didn't wait for Washington bailout. With sweat equity and innovation, they created their own solutions. These guys over here, real solutions discovered by those in the trenches. I look forward to hearing more about what led them to come up with the unique solutions they've started in their organizations. I know the debate in Washington right now is focused on the federal government trying to solve your problems for you. But I believe the people best equipped to solve Texas healthcare problems are Texans. That works, not the same old answers of more money, more government, more red tape. Our country needs real health care reform. That's why I support the Republican plan. Our plan would make insurance more affordable, more available, and more accessible. Real health care reform would allow small businesses to pool together to offer affordable health coverage to their employees. Should have access to the same benefits large corporations do. Real reform should protect doctors and hospitals from frivolous lawsuits. They should stop practicing defensive medicine and instead focus on practicing patient-focused medicine. Reform should cost Americans less, not more. It should provide better quality, not worse. And it should empower providers and patients, not government bureaucrats. By working together across party lines, we can do that. And I know my colleagues agree with me on just about everything I said. And you have a great group of panelists tonight, so I'm going to yield to them. I thank you for being here again.
Please give a warm welcome to Congressman Joe Barton.
Thank you, Dr. Goodman. I have a formal statement that was put together by my staff, and it's very good. But after Congressman Johnson's statement, I don't see anything to do but ask unanimous consent. Let me say I'm glad to be here. It's always good to be on the same stage with one of the true heroes of the United States. It's also good to come to a town hall or a seminar where you seem to like your congressman. I appreciate that. I'm glad my county judge is here, Judge Glenn Whitley. The other panelists. I will say this, as a senior ranking Republican on one of the committees of primary jurisdiction, the Energy and Commerce Committee, Republicans are not against health care reform. We do think the President's proposal is a radicalization, and some could say a socialization of the health care system. I am assuming that chart is the schematic of the President's proposal. Is that what it is? Well, and I'm also told that Congressman Johnson passed out copies of that to the participants here. If you look at that, and we'll refer to it as we go through the meeting this evening, in the bottom you see a little circle that says public option or public plan. I think it's a little purple circle. If you put your thumb over that, then look at the rest of that. Is that the reform that you want? I mean, there's so many things, the individual mandate, the employer mandate, the Health Benefits Advisory Committee, the Comparative Research Council Committee, the National Health Care Administration, who dictates what's in the private plans. I mean, I could just go on and on. I'm not going to do it because of the time, but step one, in my opinion, is defeat this. Step two is sit down with the President and his allies if he wants a real health care reform package on a bipartisan basis, and let's do stuff that meets the general principles. Everybody in America who wants health insurance should have access to it. Every doctor and healthcare provider in America who provides health care should be adequately compensated. Everybody in America who wants to access the healthcare system should know what the quality is in the system, what the cost is in the system, what their options are. We agree with the principles. What we don't agree with is a top-down, one-size-fits-all that almost guarantees that the private sector healthcare system that most of us support would be extinct within 7 to 10 years. That is not reform. That is radicalization. I especially want to hear from the gentleman from the Lubbock Chamber of Commerce who has either a co-op or a public pool that seems to work pretty well and would be something that we might could build a more accessible model on at the national level. And so I look forward to hearing his testimony. Thank you, Congressman, for inviting me.
Please give a warm welcome to Congressman Pete Sessions.
Goodman, thank you very much. I am very pleased to be here tonight, and it's an honor for me to not only serve in the 32nd Congressional District, but to share Richardson with the great Sam Johnson, and we're delighted that you have turned out this evening. During the last few weeks when we've been home, I've spent time having town hall meetings, listening to people. There was one in Richardson where over 1,200 people attended. There's one in Irving, Texas, with even more people who got in, some 1,300 people. And then I've held bipartisan meetings with Eddie Bernice Johnson downtown and also at the Dallas Chamber. And during those times, I have learned a lot from feedback from each of you and Americans talking about what they really want in health care. And we listened a lot of their needs. And one of the things that was very apparent to me is that there are a group of people who, for one reason or another, do not have health care. And I believe it's important, as we have talked about tonight, for us to focus on addressing the issues that are related to more people being able to have insurance. And that is why I believe that every single individual should have the same advantage as anyone who works for a corporation to get their health care on a pre-tax basis. There's also been discussion from people who said that they were in medical difficulty and distress, and it placed them in a circumstance where they would lose their homes and perhaps destroy or break up their families. I recognize that also. But I focused on trying to understand how we would help these people rather than trying to take 260 million Americans and fit them into a box where there may be 15 or 20 million Americans who really do need help. This country has the largest unemployment numbers in 26 years. It is not the time that we should go about having a health care bill, which the President's own numbers guarantee that we will lose 4.7 million more jobs, and it will cost more than $1 trillion. Feedback that I have been receiving in my congressional district, consistent with what I've seen around the country, should mean that the President